started. So, good morning, everyone. Thank you for joining the Office of Government Relations for the presentation of our state and federal legislative agendas for the 2023-2024 legislative sessions. My name is Sarah Mills, and my pronouns are she, hers. I'm a government relations specialist in the Office of Government Relations here at Boston Children's Hospital, and I will be moderating this event today. Next slide. So before we get started, I just want to go over a couple of virtual housekeeping rules, which I'm sure many of us are very used to by now at this point in time. But we will have closed caption available. So if you want to enable it, you can just use the Zoom menu button on the bottom of your screen and click Show Captions. Provided there is time, we will be having a Q&A at the end of our panelists' presentations. Please use the Q&A box to ask your questions. You can also use the chat to directly speak with either the hosts or other folks or the panelists, but the chat is not available for the audience to chat back and forth at this time. This webinar will be recorded, so anyone who is registered for this event will receive a follow-up email after the event with that recording, and there will also be an evaluation at the end for you to fill out. Next slide, please. For today's event, we will hear from each of our policy directors, including Shannon Moore, our Director of State Government Relations, Amara Anasike, our Director of Behavioral Health Policy and Advocacy, and finally, Amy DeLong, our Director of Federal and External Relations. As I said before, we will then have a Q&A with any remaining time at the end of the event. Finally, as you hear about our policy priorities, consider if you have any experiences with your patients or within your communities that relate to the issues we are focusing on. If any of them are of particular interest, we always encourage folks to reach out to our office because we are always looking to get our clinicians and community members involved in our advocacy. We will also be sending out action alerts on these policy priorities in the upcoming weeks and throughout the legislative session. So make sure you are subscribed to our Children's Advocacy Network so that you can stay up to date on all advocacy opportunities in the future. Those links to sign up or to reach out to us via email will be dropped in the chat. Next slide. So without further ado, I would like to hand it over to Shannon Moore, our Director of State Government Relations.
Thanks, Sarah. Welcome, everyone. I am Shannon Moore, Director of State Government Relations. I've been at Boston Children's Hospital since March of 2020, so this is my second full legislative session here at the hospital. I previously worked at the State House and for the Department of Public Health, so happy to bring that experience along with me as we work together to advocate for children's health policy at the state level. Next slide, please. Just some quick updates on the state level. We have a brand new governor and lieutenant governor. We're very excited to welcome them to state leadership. Their historic win as the first duo elected is, female duo elected to the state. We're really excited to get to know the new administration and all her appointees, and we welcome them to the team. Next slide, please. I'm not going to go through this whole slide, but we just wanted to show the different ways that bill becomes a law and all the different opportunities we have for advocacy. These can include writing letters, bringing live testimony to the State House, contacting the governor's office or legislature through emails and action alerts. So there's so many different ways you can participate in advocacy throughout this process. And the Government Relations Office is here to help you through that. So we welcome the opportunity to work with you on all of the different steps on the way that a bill becomes a law. Next slide, please. So how do we come up with our legislative agenda? We consider all different parts of the hospital and feedback before we come up with these topics, but we highlighted here the legislative survey. We first did this back in the summer of 2020 when we were trying to figure out how best to prioritize all the different things that we were worried about during COVID. Not surprisingly, at that time, so many different health-related social needs that seemed emergent during COVID came back as the priorities that folks wanted us to work on at that time. The the legislative survey from this summer brought up some bigger, broader issues in addition to kind of those health-related social needs that we're all concerned about. So we're excited to bring some new topics to the legislative agenda, some topics that are carrying over that still need some work, and really feel like this is reflective of what we heard from the many different participants in the survey. And the survey went out through the Children's Advocacy Network. So if you're not signed up, please do. The next one will be, after this legislative session. So not for a little while, but, we welcome feedback throughout this process. Next slide, please. So just to mention, we don't do this work alone. We do this with the help of so many of our coalition partners. We really look to them to add our voice to the conversation, to help guide us in what is needed at the State House. Just to mention all these wonderful organizations that help us drive children's health policy at the state level. Next slide, please. So we're going to dive into the legislative agenda now. And if you've been on our agenda before, we have grouped it into different categories based on the needs of the populations that we serve. We do recognize that many of these bills fall into multiple buckets, but for the purposes of just organizing and kind of keeping things clean, we've kind of separated it into separate groups that help us to navigate what these priorities really mean for kids. And just another note I want to mention, if you don't see a topic on any of these slides, it doesn't mean we're not tracking it or working on it. But these are the bills that we have prioritized as things we will provide written testimony on, testify in person, have meetings with legislators. So if there's other topics that you would like to advocate for, we are happy to help with that as well. So don't hesitate to reach out. So the first bucket that we have is what we call our healthcare access bucket. This is really ensuring that kids have access to quality, affordable, geographically appropriate healthcare, and really addressing some of the health inequities that we see in the current systems in the state. Next slide, please. So what do we advocate for in this bucket? We really consider the two priorities here to be mass health and telemedicine. For mass health coverage, with the end of the federal public health emergency, Mass Health is going to be looking at who is eligible for continuing to stay on Mass Health, and we really want to make sure that no kids who are eligible have any interruptions to their coverage. We also work very closely with the Healthcare for All Coalition on Cover All Kids. This would expand full mass health coverage to children regardless of their immigration status, whereas they're not currently eligible for all the benefits of full mass health, causing delays in care in some cases and more acute presentations by the time they arrive at our hospital. Another thing that we're excited to continue working on is telemedicine. We know we've heard so many great stories from patients and families about how telemedicine has really helped them to keep their kids out of the hospital or really access care and behavioral health here. So we will be working with the TMED Coalition from the Mass Hospital Association to continue monitoring the Division of Insurance regulations and also supporting payment parity for services that aren't currently covered by insurance. Next slide, please. So our next bucket that we have here is social determinants of health and health-related social needs. We heard loud and clear, as I mentioned during our COVID survey, that folks were really concerned that children were going to lose access to all the social needs programs that the state offers, especially during such turbulent times. Food insecurity, housing instability, lack of transportation, all these things that help keep kids healthy at home and improve their health outcomes fall into this bucket. Can we get the next slide, please? So on this part of our agenda, we have our newly added early education. This was one of the top new things that had come to the top of our inboxes when we put out this survey. There is a big push right now at the State House to increase access to affordable, accessible early education and childcare. including access to early intervention services. We know that the state will be acting on this, so we're just really excited to help push that across the finish line and really make sure that the bill that they put out is truly affordable to the folks who need it. We also, carrying over from last year's legislative agenda, will continue to work on programs that prevent homelessness and also preserve tenancy for folks who are struggling to pay their rent, and also make sure that the programs that the state offers have access to safe housing and as well. For adolescent health education, we've heard from a lot of our staff here that they really are concerned about youth and adolescent education and well-being. We're looking at bills that would encourage safe and healthy relationships, teen pregnancy prevention, social media use, and making sure that all these bills address the LGBTQ youth populations as well. For food access, once again, we'll be working with Project Bread on the Feed the Kids Coalition. We will do this primarily through legislation that will expand the current free school meals program, which provides free breakfast and lunch for kids in K-12. We know that kids who are fed can learn and have better health outcomes. So we're really hopeful that we can expand this program to a more permanent program where right now it is being funded on a year-by-year basis. Next slide, please. So we also have our racial equity and social justice bucket. We, as part of our mission at the hospital, are committed to racial equity and health equity. And we want to make sure that this is reflected throughout our legislative agenda as well, ensuring that the bills we support integrate racial equity, not just through our policy agenda, but through everything that we do in this office. And so we hope that these bills will help to promote some of that goal, as I'll explain here. Next slide, please. So when we sent out the survey, we have these two new issues at the top with the stars. Environmental justice, climate change, and sustainability came through as one of the top concerns that folks wrote into us about. Really particular focus on issues for environmental justice communities, reducing environmental health exposures, and just educating the legislature on why children have different health impacts that greatly, increase asthma and other factors that go into their health that we're really worried about with global warming. We're really excited to kind of add our voice to this conversation. The state's already doing a lot of great work, but anything we can do to show them that, kids really are impacted by these changes will go a long way with the legislature. We also heard a lot of concerns about youth violence, and we wanted to add this to the legislative agenda. So we'll be supporting policies at the legislature that address the root causes of violence, including gun violence and violence in the community. We're also looking at supports for domestic violence victims and witnesses to violence for kids, and also advocating for the prevention of violence in schools, and also how schools support kids who are witnesses to violence or at risk of committing an act of violence, and how can we really support the legislature in their efforts. The next two are topics we're continuing over from last year. We know that racial inequities in maternal and infant health remain in our healthcare system. So we have been working with Healthcare for All on their efforts to reduce inequities in maternal mortality and morbidity. We last year supported legislation to expand mass health postpartum for 12 months for parents who are post-birth, so that they can take care of themselves while taking care of their baby. And we'll look forward to working with Healthcare for All on this part of our legislative agenda in the upcoming year. The last thing on here, we have economic mobility and anti-poverty legislation. We know that promoting economic mobility is really important for families to take care of their kids. Last year, we were supporting the expansion of the earned income tax credit. Unfortunately, it almost made it to the finish line last year, and very late in the game, it was removed from a piece of legislation. So we will be working with our coalition partners over at the Healthy Families EITC Coalition to continue advocating for these important benefits for families in our state. And with that, I think I'm passing it over to Amara, if I'm correct.
Thank you so much, Shannon. Good morning, everyone. My name is Amara Anasike, as Sarah mentioned, and I am the Director of Behavioral Health Policy and Advocacy here at Boston Children's Hospital. Like Shannon, I came into this role in 2020. Previously, I worked in the healthcare division in the Office of Attorney General Maura Healey, who is now our governor. And prior to that, I spent a few years in our general counsel's office here at Children's. So while I am very excited to share our 2023 and 2024 behavioral health legislative agenda this morning, I want to first acknowledge that we are still navigating a national children's behavioral health crisis. There continues to be significant access issues with limited community-based options for children, which means that oftentimes the emergency department becomes the most accessible place to go. And so for children with complex needs, such as children with co-occurring autism, children with co-occurring medical complexity, or children with state agency involvement, wait times are often much longer throughout the continuum of care. And yet still, in the last session, we have made some progress, and many important steps were taken by the previous administration and by the legislature, including the passage of an act to address barriers to care for mental health, and the roadmap for behavioral health reform. Many of the accomplishments of these last 2 years were made possible by the advocacy and engagement of many of you who are logged on today, and through our collective partnership with various coalitions that we work with to enact change. So thank you for that. And with that, I would like to get started on our agenda. So next slide, please. So for behavioral health, what is our commitment as a hospital? Of course, we're committed to ensuring access to high quality behavioral health care for children across the full continuum of care. Behavioral health encompasses a lot of things, including promotion of social and emotional well-being, prevention and treatment of mental health conditions such as substance use disorder, developmental behavioral challenges, and trauma-related health conditions. We really want to make sure that we are supporting culturally relevant and equitable models of care and the establishment of a robust pediatric behavioral health workforce. We understand that in order to do this, it will require a comprehensive and collaborative approach across stakeholders and systems to ensure that children are able to access the right behavioral health care at the right time. Next slide, please. So I also wanted to shout out many of our advocacy partners, in particular the Children's Mental Health Campaign, in which we are an executive member, with other reputable organizations across the state, including MSPCC, Healthcare for All, the Mass Association of Mental Health, PPAL, and Health Law Advocates. We also work very closely with the Massachusetts Hospital Association and the Massachusetts Association of Behavioral Health Systems. On the federal level, Amy will talk about much of the behavioral health work that we do there with the Children's Hospital Network, Children's Hospital Association. Next slide, please. So we've really been focusing on advancing statewide access to upstream school-based social and emotional and behavioral health services for all students. We know that that's where students are. We know how important schools are to the well-being of students. And so with that, we really want to focus on supporting school personnel, including admin and teachers, to promote wellness and identify behavioral health needs at an early stage. This is an opportunity for us to meet children where they are, irrespective of their zip code. We want to make sure that all students have access to school-based behavioral health. It really is a matter of equity. And so in order to do that, we need to establish equitable and sustainable funding models, which recognize that this work is being done and it should be applied equitably across the state. And so we're doing a lot of this work with the Birch Project at UMass. Next slide, please. Workforce development is critically important. We know that nationwide there really is a behavioral health workforce shortage. It's something that we've also seen here in Massachusetts. So our focus is to invest in a culturally responsive workforce, utilizing strategies to attract and retain individuals from diverse backgrounds. That includes increased payment and rates for providers, expanded opportunities for loan forgiveness. But even before loan forgiveness, we're really thinking about how can we remove that barrier to entry and provide scholarships and grants, enhance training and educational opportunities, supervision opportunities, ladders within the workplace. So how can we think comprehensively about attracting and retaining a robust and diverse workforce? And we're also thinking about this across disciplines. So it's not just psychiatrists that we need more of, which we definitely do, but we're thinking about this along the lines of psychologists and social workers and nurse practitioners and peer supports. And we're thinking about this beyond psychiatry, which is needed, but also we're thinking about supports for developmental medicine, substance use providers. So this is incredibly important, and we want to make sure that we're doing it in a way that is multidisciplinary and definitely thinking about cultural responsiveness. So next slide. I mentioned previously that access issues for all children in the behavioral health space is definitely a challenge and something that we're navigating. And also for the children with the most complex needs, we really need to think about them. As I mentioned, they wait for longer periods of time to access care throughout the continuum. So whether that be in the outpatient space or the acute space. So how can we address those system-wide capacity gaps, which result in long waits and boarding in the emergency department or on medical units, or even becoming stuck in inpatient psychiatric units due to a lack of treatment options across the continuum? How can we bolster residential, educational, and state placement option settings for all children, including children who are state agency involved, such as the Department of Children and Families or Department of Mental Health? How can we make sure that we're supporting resources for that subset of that population? And this really recognizes that children have nuanced behavioral health needs that can and should be met in various settings, which are not exclusive to inpatient psychiatric units. So next slide, please. And then our final focus will be on implementation. As I mentioned, there were various policy successes from the previous administration and the previous legislature, the legislative session. We want to make sure that those successes are implemented well in a manner that really increases access to behavioral health care. And we're really going to focus on enact addressing barriers to mental health care, which had a lot of pieces in there around school-based behavioral health, including the establishment of the Technical Assistance Center and behavioral health crisis plans for schools, and a reduction in school suspension and expulsion for preschoolers. It also had various provisions in there to address the boarding crisis, for increased payment, to address parity. And with that, many regulations will be coming out, bulletins and policy. And so we will be monitoring those things to make sure that as they roll out, they're rolling out in such a way that maximizes access to care for children. Next slide, please. And here are some examples of some of the implementation that is already underway. So the Division of Insurance has released multiple bulletins related to Chapter 177 around requiring annual behavioral health wellness exams, for instance, or establishing payment for the care provided to patients while they're boarding. And also EHS has released proposed regulations for which we provided comments on in terms of the interagency review of complex behavioral health cases that we see at the hospital. And so we've been making sure to be engaged in providing comment and feedback to ensure access to care. Next slide, please. Also, the roadmap for behavioral health reform implementation has been underway, and we have been following that every step of the way. There have been some updates, welcome updates in terms of the launch of the behavioral health helpline, which is a centralized front door to care where people can call and chat and find out about service offerings. There also been establishing community behavioral health centers responsible for covering different geographies across the state. And then behavioral health urgent care is underway. And so if folks want more information about these, there's obviously the website that's on this slide. And the Massachusetts Network of Care is also a great resource to find out about some of the changes that have been happening and some of the things that have been underway. I think that might be my last slide in terms of updates. Yes, so I will pass it along to Amy. Thank you.
I cannot start my video. I think the host needs to change something. It says the host has stopped it. So we'll see if we can do that, but I can start talking. Here we go. Hi, so I've been here at Boston Children's. I'm Amy DeLong. I use she, her pronouns. I've been here at Boston Children's and in the Office of Government Relations for a long time, for 14 years, working on federal policy. So that's things happening at a national level that impact kids and the institutions that care for them. Previously, I worked for a congressman from Rhode Island in his Washington, D.C. office, handling healthcare and children's issues, and also at the Children's Defense Fund, so the children's policy space for a while. We can go ahead and start the slides. And I'm excited to talk today. Welcome to the 118th Congress. The 118th Congress has actually already received quite a bit of national attention, but it is still getting organized. So just to take a couple minutes and talk about that organization of the Congress. It's similar to the state in the sense that it runs on a 2-year session. So we set our priorities on that 2-year timeframe. Elections were held this past November, and those elections determined the makeup of the 118th Congress, which was sworn in just a few weeks ago in the early part of January. So a noteworthy thing is that the House of Representatives, which is one of the 2 chambers that make up our Congress, changed from being a majority of Democratic members to a majority of Republicans. And this has implications in terms of setting the agenda, both our agenda and their agenda, but ours in the sense that we have to consider what is viable and who are the most appropriate people to lead our priorities. Because members of the majority party share the committees where a lot of the work is done, they have more seats on those committees and generally set a lot of the agenda for what the House will aim to work on and be able to pass throughout the year. So this is a big change, and it was definitely on display earlier this year when the very first vote, the election of the speaker, was a hard one for the Republicans to internally come to consensus on, but they did elect Representative Kevin McCarthy as speaker. So instead of seeing Nancy Pelosi sitting behind Joe Biden during the State of the Union when it happens next week, it'll be Kevin McCarthy because of that change. So on the other side of Capitol Hill, the Democrats retained the majority in the Senate, so not as much change there, but of course, for any bill to go to the president's desk for a signature, it has to pass both the House and the Senate. So with different parties leading each chamber, it might be harder to get things done, but we've had this before, and hopefully the important priorities will prevail. So I also wanted just to call out a few changes in the New England congressional delegation. There weren't many changes, but I'll take this opportunity to say we're a hospital in Boston, Massachusetts. We've worked with the 9 members of the House from Massachusetts and our senators over many, many years. We're in Massachusetts. But in the last 15 or so years, we've also been working hard to expand the group that we consider to be our delegation to include the other New England states. This is important to our reach in Washington, D.C. when you consider the scope of Congress. Massachusetts is a relatively small state, but as a region, we're bigger. And we're the only large academic freestanding children's hospital in New England. minus Connecticut. I'm not counting Connecticut right now when I say New England, not because they're Yankees fans, but because they actually have a freestanding children's hospital that is in their state. So they kind of cover that. So we see it as a responsibility to ensure that those members from New Hampshire, Vermont, Maine, Rhode Island understand the role that we play in the region, and also that we're ensuring access to care for kids who might need to cross state lines to get the subspecialty level of care that we can provide, which we'll talk about when we get to the agenda. So Catherine Clark, who's a member of the Massachusetts delegation, was elected as minority whip for the Democratic Party. This is an election that takes place within the caucus. So her peers in the Democratic Party in the House elected her to be minority whip, which is actually a really, really important job. We saw the importance and the challenges of being the whip on display when the Republicans were struggling to keep their caucus all together during the speaker election. Essentially, her job is to make sure that the Democrats are in agreement and working together as a group to advance their priorities. So Catherine Clark knows Boston Children's well. She served in the State House here in Massachusetts for years before being elected to Congress. She's led multiple priorities for us over the years, and it's really great to have her in that kind of leadership role. I think she'll be great at it. So that was interesting and exciting. And also in the New England delegation more broadly, just due to a couple of retirements, we have 2 new members of the House, Seth Magaziner from Rhode Island and Becca Bayland from Vermont. And then former Representative Welch moved from his role in the House to be the newest senator from Vermont. So now he's Senator Welch. So with all this, I guess, context in mind about the new Congress, we can move to the next slide, which is about our federal agenda, which is still coming together a bit. In order to accomplish anything in Washington, the state team talked about this too a bit, that with working in coalitions, we really need to work with others to set our priorities in order to be effective. Additionally, there's no bill filing deadline in Congress. So for better or worse, the introduction of bills, including our priority bills, tends to be more fluid. It may not happen in January. It may not happen by the summer. It could happen at any point during the next 2 years. So what I'm going to walk through is a bit more thematic than specific. And actually, we're still open to some feedback and hearing from people. So please, as people have been saying, be in touch if you have thoughts about these issues or things that you might be hearing about. I know a lot of folks who work at Children's belong to professional associations and might hear about what those organizations are seeing as viable or important in the 118th Congress. And we'd love to hear more about that from you. But first, in the category of workforce sustainability, it's an important year for the Children's Hospital Graduate Medical Education Program, which you may have heard of before. It's a relatively small, compared to like Medicare, relatively small federal program that Boston Children's and other freestanding hospitals receive government funding from to fulfill our teaching mission. So it's extremely important to hospitals like Boston Children's that are not part of a bigger system that also sees adults, but where we only see kids. We are a teaching hospital. So in order to fulfill the teaching component of our mission, we rely on some support from the government. And this CHGME program is the only way we get that support. We're not eligible for Medicare GME, which our peers who are training adult providers receive. And it's actually a good example of how children and their providers are sometimes an afterthought in the healthcare system. The Medicare GME program has existed for a long, long time. It's an entitlement program. So there's a formula. Congress doesn't get to decide every year if they're going to fund Medicare GME or fund Medicare. They have to. It's a law. And adult training hospitals receive funds through the Medicare GME program as part of a formula. For a long time, children's hospitals like ours that don't see a high enough threshold of Medicare patients were just ineligible for Medicare GME and didn't receive any federal support for our teaching programs. And perhaps not surprisingly, this led to a shortage of pediatricians, pediatric specialists that was so pronounced around the late 90s, early 2000s. It came to the attention of Congress, and they said maybe it's because we're not supporting their training in the same way we support the training of adult physicians. And they created this standalone separate program called the CHGME program. And it works. It funds our training programs. It provides funds to, I think, 56 different children's hospitals across the country that, like ours, are focused on training pediatricians and pediatric specialists. We are one of the biggest. We're one of the largest institutional recipient of funds from this program. So while it works and the shortages are less pronounced than they were before we had CHGME, we still only receive about 50% per trainee of what adult training programs receive through Medicare GME. So we've decided as a collective children's hospital community, it's time to fix that. So we're asking for reauthorization of the program, which means they'll renew it, and they have to do that every 5 years. The program is due to expire September 30th of this year. So it needs to be reauthorized, but we're also asking for an increase in that authorization and in the appropriations for this program. So because of that sort of big ask, an important ask, you'll see a lot about CHGME from us in the next 9 months. And we're looking for advocates to join in this effort. So if your work in any way touches residency programs, the teaching mission component of the hospital, we're definitely looking for advocates to join us in this effort. So CHGME, big priority, big year for the program. Pediatric research is something that we've long worked on. We work in coalition with other research institutions focused on pediatrics to ensure that we have a robust landscape for pediatric research. So not only just increasing funding for the NIH, which a lot of groups advocate for, but we're really focused on advancing policies that ensure that a more proportionate amount of those dollars go to research on diseases that present in childhood. Additionally, through this coalition that we work with, we work to have like a voice in any national research endeavors, things like the Cancer Moonshot, which is a priority of the Biden administration. The ARPA-H effort, which folks may have heard about, it's a new agency designed to leverage research advances for real world impact to make sure that pediatrics is represented in all of these endeavors. So there'll be more to come in this research area as well. The third bullet, ensuring all children have access to quality and affordable healthcare. In recent years in the federal space, a lot of what this comes down to is removing barriers for kids, especially kids who are insured by Medicaid and need to access appropriate care, especially children with medically complex conditions who often need to access subspecialized levels of care that not many places can offer. We've worked on a bill that we expect to be reintroduced in the coming months related to Medicaid screening and enrollment. There's a requirement that a facility seeing a child from an out-of-state Medicaid program, which we see, not just a child, there's a requirement for a facility seeing an out-of-state Medicaid patient. The facility and the providers be screened and enrolled by each of those state Medicaid programs before we can see a child from their state. So it's administratively burdensome. It's not a requirement for Medicare because it's a national program, but because Medicaid is run by the states, there's a lot of hoops that need to be jumped through. And if you work on the side of the institution that touches that, you've probably experienced it. It's a problem that's shared by the bigger children's hospitals because pediatrics is so regionalized. This is an area of medicine where people do need to cross state lines for care on a very regular basis. We see kids from well over 40 different Medicaid programs each year. So it's dealing with 40 different states. And we've worked together to come up with a solution that would streamline the process for becoming screened and enrolled in an out-of-state Medicaid program. So we've worked together with other children's hospitals who share this concern on this. We've had a bill introduced in the last few Congresses. The lead Republican on the bill last session wasn't reelected, so we are working to figure out a new lead. But the bill remains a priority, and we'll be talking about that. Also in the category of things that aren't unique to Boston Children's Hospital that are affecting kids and institutions across the country, and we're working with our peers on national solutions, the pediatric mental health crisis, which Amara spoke about. And Amara and I have worked together some to share and learn from best practices where they exist at hospitals, other children's hospitals, and also together with those hospitals, mostly through the Children's Hospital Association, to identify some national solutions. Much of this comes down to asking Congress for new investments, and we're seeking to bolster capacity and infrastructure, and it will take new programs and new investments in prevention and treatment in order to reverse this trend that we're seeing. This is also an area where we're focusing on our workforce efforts and looking to partner with others on national solutions. So behavioral health will be a big topic at the federal level as well as the state this coming session. So as I mentioned, we can go to the next slide. Nearly everything we do in Congress requires partnerships with others, and these are some of our most frequently partnered with organizations, everything from the Children's Hospital Association, which is like a trade association of children's hospitals based in DC that helps coordinate a lot of our public policy work, to consumer groups. There are many disease-specific specialty advocacy groups that some of you watching may belong to, either as parents or providers or just members of the community. And this is an area where we'd love to hear from you about what the groups that you're working on might be focusing on, or if there are things that we're working on, they might like to partner on with us. Kind of like Shannon said during her presentation, these issues I've discussed are priorities for the upcoming agenda, but it doesn't mean there aren't a lot of other things that we're tracking, supporting the work of others on. And there are always things, especially at the federal level, it feels like, that arise unexpectedly. It happens a lot. So not an exhaustive list of themes and things that we'll be working on, but hopefully gives a sense of the priorities and what we do hope to get done in the next 2 years. So I think that's the end for me. So I can stop there, and I think we're moving to questions.
Great. Thank you so much to all our panelists. They're all going to come back on now and turn their cameras on so that we can go into a Q&A. So as we said in the beginning, if you have any questions, please use the Q&A function at the bottom of your Zoom screen. I know some folks have been asking questions, and we have some Office of Government Relations folks in the background where you can't see them, who have been kindly answering some of them live. But we do have a couple that came in with registration and a couple that have come in, so we'll just get started. The first one is for Amara. How does Boston Children's provide support for school wellness programs?
Thanks, Sarah. That's a great question. So we do that in multiple ways. First, I should mention our Boston Children's Neighborhood Partnership Program, which is led by Dr. Shella Dennery. And through that program, we embed about social workers and PhDs in 25 Boston Public Schools to provide school-based behavioral health supports to those children. But also for kids beyond Boston Public Schools in those 25 schools, through that program, we provide training and access, which offers high-quality professional development and consultation services to school personnel nationwide, which is online and available to school teachers and admin to learn more about how to provide social and emotional supports in school settings. Through our policy efforts, we've successfully advocated for a statewide school-based technical assistance center, which is currently being implemented. And we found that it was really important to do something statewide because oftentimes this kind of work varies from school to school and district to district. And we wanted to make sure that schools statewide had the same kind of access to provide school-based behavioral health for students throughout the state. So that's just some of the ways.
Awesome. Thank you so much, Amara. I'm going to ask a question that just came through the chat, but was also in the registration. This is for all panelists, and it's what's the most effective way to get our policy priorities passed? And how do you engage clinicians and advocates to help us in our work? Why don't we start with Amy?
Sure. Well, I think first and foremost, being a subscriber to the CAN email newsletter, the Children's Advocacy Network, you'll get regular updates about not just events like this, but also about things that are happening like in real time a bit at the state level and the federal level. And when there are opportunities for advocates to call your own member of Congress or weigh in that way, that's the best way to know about it. And Alexia just put it in the chat. So if you're not signed up, if you didn't get an email about this event, if you found it in some other way, definitely sign up for that. And then I think we all, in the course of talking about our agenda items, there's a lot of room for input from people who have specific experience in that. Like I mentioned, we'll be working on CHGME. So if you are a resident or if you trained at a children's hospital, or if you work with the residents in any way and understand how important keeping that program robust is to this hospital and to the future of our pediatric workforce, I would love to hear from you and talk about different ways we can personally get people involved on that like specific issue where they have experience in. I don't know if you guys have things to add.
Yeah, I think the CAN is the #1 way that is the quick and easy advocacy way. Our office also sends out alerts from that email if you'd like to take one of our advocacy trainings where you can learn more about the different ways of advocating. If you're interested in more than just advocating through our email list, we're always happy to receive stories from clinicians and patients' families about how any of these bills would impact their personal experience. So we call that story banking. So if you want to jot down a patient story, we're happy to to help you with that. So it's de-identified information. We will log that in our system and potentially use that in testimony or written or oral testimony. We're also always looking for folks who are interested in participating in meetings or oral testimony as well. So we do keep a list of those type of folks if you'd like to be added to those lists. Otherwise, sometimes we also bring folks up to the State House for meetings. If there's a specific bill that you really resonates with you and your department, please let us know so that we can meet with you and talk about the more specific ways that you could help us with advocacy. And our emails will be shared after this webinar as well. So please don't hesitate to reach out at any time if you have questions about anything on the agenda or how you can help. We welcome your emails.
Thank you so much. Amar, I don't know if you have anything to add. I know everything was basically listed, so if not, that's totally fine.
I'll just flag the Children's Mental Health Campaign that folks can also check that out for behavioral health advocacy opportunities as well.
Great, thank you all. Yes, we have many ways to get involved, and just to flag for folks joining in, we will be sending out an email, follow-up email to anybody who was registered, whether they were able to attend or not. That will include the recording to this event, the slides to this event, all of our contact information and ways to sign up for these action alerts. So if you're not able to write it down, or if you're not able to get that information right here during the event, there will be an email coming through. So we're really hopeful that folks will take advantage of that and work with us. We have a question here. Let's see. How do you work with the Dana-Farber Legislative Action Committee, and what is the most effective way for parents and families to be involved?
I can take that question. So we are very close with the Dana-Farber. As some folks on this call might remember, Kate Audette, who had this role before me, is over there in the government relations office. We work very closely on many parts of her legislative agenda. Obviously they're a sister partner over there. I don't know exactly what bills are on there, but I know I see her on lots of calls about children's health. So I'd be happy to see what is on their bill list this year and happy to facilitate any conversation. So please feel free to send me an email if you have questions about that. And I'll certainly be in touch with her about the best way to support their agenda as well. But thank you for the question, and I'm happy to follow up.
Thank you. This is one that I think Amy would like to answer. It says, I think in working with with CMC, families really need more help with care coordination of community services, such as private duty nursing, DME companies, prior auths for meds, etc. Is Boston Children's working on any legislative actions to support these types of community services?
Yeah, I liked seeing that topic come up because there is a lot to coordinate, and especially if the child lives in a different state, but even if they live in Massachusetts, this comes up a lot. And we, for many years, one of our top priority legislative agenda items at the federal level was the ACE Kids Act. ACE stood for Advancing Care for Exceptional Kids. That actually passed into law a couple of years ago. So we're in the implementation phase with the ACE Kids legislation, but I guess is now not legislation, the ACE Kids law, and have been working as a region to try to do something in a common way that can support these families and make use of the new federal resources that come through the ACE Kids law at the different state levels. So we're working on the implementation of ACE Kids, and obviously there's still a lot of outstanding care coordination and work that remains. So if the person who asked the question wants to follow up with me separately, I'd be happy to talk more about it. But we're sort of outside the legislative phase on ACE Kids now and in the implementation phase.
Thank you, Amy. Our next question is sort of Shannon, maybe, and Amara, but all aspects to improve behavioral health for adolescents are so important. In addition, will there also be support for injury prevention bills, for example, around seatbelts and children under 13 in the back seat, or car seats rear facing until age 2, etc.?
Yeah, that's a great question. As I kind of mentioned, if you don't see something on the list, it doesn't mean we're not working on it. And this is definitely one of those cases. We work really closely with the injury prevention folks here at the hospital. They're wonderful advocates, both locally and nationally. We have sent written testimony in the past in support of those bills to encourage the safe seat belts and the rear facing car seat law. So that's just one example of somebody reaching out to us and saying, hey, we'd really like to support this bill. What can we do? And the Office of Government Relations turning that idea into written testimony and additional comments on the bill. So I'm really glad that you brought that up. It is something that we have on our internal tracking system. And if, again, if there's other things that folks on the call are curious about, how we track it or would like us to track and keep them up to date, please don't hesitate to email somebody on the call, and we will make sure that we get your question directed to the right person. Thank you for that question.
Awesome. Well, we have no more questions in the queue, so happy to give folks a couple minutes back in their day, but really wanted to thank everyone for joining to listen and learn about what our legislative agenda efforts are going to look like in this upcoming session. Thank you to all our panelists. And as I said earlier, please do not hesitate to reach out to anyone in our office. We're always looking to collaborate with clinicians and with folks in the community to advance all of these priorities. And so thank you again so much to everyone, and we look forward to hearing from all of you. Take care.
Thanks.